Dear Chair, dear audience, let me introduce my PhD thesis, which is Daily Aspects of Oral Medicine. I am Bálint Zsombor Sárai, a first-year PhD student and a clinical dentist in the Department of Public Dental Health. My supervisor is Orsolya Németh, my SMS is Kata Kelemen. My mission is to make a positive difference in all patients' life. My vision is to achieve affordable and good oral health for everyone. To achieve this, I have two ongoing projects, from which the first is investigating the efficacy of different treatment methods in oral lichen planus, which will be a systematic review and a network meta-analysis. The project started in September 2023. The co-investigator for this topic is Eli Guttmacher. Regarding the pathogenesis, oral lichen planus is a chronic inflammatory disease of the oral mucosa. Because of sensitivity, the patients at first avoid spicy food. Later, they can only eat neutral taste food and they can drink only warm water. The striae cause tension in the mucosa, which makes a constant discomfort. The disease is not life-threatening, but it reduces the patient's quality of life for decades. Over time, social anxiety and depression can also develop. Speaking of its treatment, there is no gold standard. Topical steroids are used in the first line, however, these have numerous topical and systematic side effects. Recently, calcineurin inhibitors, which reduce the concentration of pro-inflammatory cytokines, have also taken place. Our aim is to compare the most frequent treatments to get the most effective result. According to that, our question is, which is the more effective treatment, topical steroids or calcineurin inhibitors in patients suffering from oral lichen planus? Based on the PICO framework, our population is patients with OLP. We are comparing calcineurin inhibitors, topical steroids, and placebo to each other to get the outcomes of lesion morphology, severity of pain, and adverse effects to investigate the safety. Our hypothesis is that topical calcineurin inhibitor treatment has better efficiency and longer effective period than measured in topical steroid therapy for OLP. Our systematic search was conducted in November 2023 in 4 databases with over 4,000 hits, with the search key mentioned on the slide. After the selection process, we got 28 eligible articles for the data extraction part. From these 28 articles, we have 3 finished analyses with outcomes: severity of pain using the visual analog scale, lesion morphology using the clinical scoring system, and adverse effects, a type of adverse effect, the transient burning. Recent analyses are focused on the severity of pain using the visual analog scale. Pain is measured on a 10 centimeter long scale by the report of the patient. A total of 5 studies were included with 3 kinds of treatments and data on 275 subjects. According to Sucraplot, calcineurin inhibitor therapy was the most efficient, followed by steroid therapy, and placebo had the least impact on decreasing pain after 4 weeks of treatment. A closer look at the leak heat plot shows us that calcineurin inhibitor therapy was the most effective choice, as the pain decreased 1.32 more compared to placebo and 0.11 more compared to steroids. However, our data is statistically insignificant and also clinically irrelevant for us. The next outcome is lesion morphology. We included 3 studies that described the mucosal appearance on a scale from 0 to 5 according to Tong Prazom and colleagues. We were comparing calcineurin inhibitors to steroids with 79 subjects in each group. The effect of measurement was mean difference after 4 weeks of treatment. As you can see, steroid therapy was more effective compared to calcineurin inhibitors. However, we have no significance and also no clinical relevance regarding to that. The heterogeneity was low. Our last outcome is a type of side effect, the transient burning. Transient burning occurs during the first 2 days of treatment after the drug application. Also, we were comparing calcineurin inhibitors to steroids with 121 and 126 subjects in the groups. The effect of measurement was odds ratio, and as you can see, transient burning occurred 2.5 times more in the calcineurin inhibitor therapy compared to steroids. However, this is statistically insignificant, but it's clinically relevant for us. The heterogeneity was low also. According to these analyses, our study has the strengths that this is the first network meta-analysis in this topic. We included only RCTs, and there are direct and indirect comparisons between the treatment possibilities. Also, our limitations are that we have a small sample size from a heterogeneous population, and there are different treatment periods subgrouped together. According to our results, we can conclude that calcineurin inhibitors are equally efficient as steroids. However, they have more side effects during the first 2 days. For the research part, there is a big need for a universal scoring system. There is a need for longer follow-up periods and a detailed side effect report. We have finished the risk of bias assessment and the grade assessment. I have written the manuscript and sent it to my supervisor, who checked it and sent back to me. And now I am rewriting some parts of it, and after that, we can send it to internal review. My second project is investigating the efficacy and safety of laser therapy on oral mucosal lesions, which will be a systematic review and meta-analysis. Oral mucosal lesions can be complications of radio or chemotherapy, or can have autoimmune origin. These lesions start to develop in an asymptomatic manner, followed by the presence of erythema, burning, and increased sensitivity. Erythema may progress to desquamation, followed by the appearance of desquamation, ulcers associated with dysphagia. Because of its complexity, there is no standard treatment. The topical and systematic treatments include avoiding certain foods, use of local anesthetics, topical steroids, or anti-inflammatory treatment regimens. Recently, there is a newer approach that uses laser to prevent and heal these oral mucosal lesions. Our aim is to help patients with recurrent pain to live a quality life. According to that, our question is, how efficient is laser therapy compared to conventional therapy in oral mucosal lesions? We will compare laser therapy to conventional treatment in a population with oral mucosal lesions to get the outcomes of healing time and severity of pain. Our hypothesis is that laser therapy has better efficiency, less harmful effect, and promotes healing better than conventional treatments on oral mucosal lesions. Our systematic search was conducted in April with over 14,000 hits with the search key mentioned on the slide. After the selection process, we got 301 eligible full texts, and now we are working on the full text selection. We have around 160 left for the data extraction, before the data extraction. To mention my names, I would like to submit my first project in October and my second in December 2024. To end my presentation, I would like to mention a quote from Katinka Hosszú, who said, "Success is an achievement and not a final destination." Thank you for your attention.
Congratulations to your project. I have a question regarding the second project. What do you mean with the conventional therapies which you are comparing to the laser therapy, and what does it all include, and does it also include surgery?
Thank you for the question. The most common conventional therapy is the use of topical steroids.
Okay, and it can also, it can be compared to the laser therapy in every manner, like every drug or every steroid. There's no difference that need to be considered.
We can group together as steroids, and we can compare it with laser.
All right. Thank you.
Thank you.
Expecting the heterogeneity of using the laser, because the main problem with the low laser therapy that everybody use different power, intermittent, continuous, seconds, time, which day they use it, how long they use it, and so many.
Yes, we try to group together in small subgroups the most common times used and the most common lasers used, but I think it will be a big heterogeneity because of what you mentioned.
So the wavelength, also
Yes.
and that's why I don't understand why there is no, first of all, animal study should be done with several factors identified, and then we use clinical. Yeah. Any more questions?
I have a recommendation for your first project. Shall we go back to the implication for the research and implication for the practice slides? Yeah, that's. Need not only the longer follow-up period or detail the side effect, but I think it's need more patients who involved the different projects, because when you investigated the side effect, is the event number was very, very low.
Yes, yes.
And
we have a small sample size.
Yeah,
Yes.
it's very, very small. 3 or 4 events were in the different
Yes.
studies, and it's not
There are,
too
there
biologically
are
or
no
population.
side effect reports.
Yeah.
Just they mentioned that there were no serious side effects reported, and that's all that they reported.
Okay, thank you.
Thank you very much.